Around the world, every minute, a man will end his own life. This is a rate 3 times higher than we see in women. Although in many societies men enjoy more opportunities, privileges and power than women, countless studies and statistics confirm that these advantages do not make men healthier or help them live longer. As a global average, women outlive men by 6 years. So, what's killing men? The most common cause of death in Malaysia is heart disease, which kills significantly more men than women. But this isn't the only metric where men are worse off. Malaysian men are more likely to be binge drinkers, are killed on the road at a ratio of 4 to 1, are over 20 times more likely to have a drug addiction, and up to 40 times more likely to be tobacco smokers. If this wasn't enough, research from the US and the UK shows that men are less likely than women to seek help from health professionals for problems as diverse as depression, substance abuse, physical disabilities, and stressful life events. They go as far as to say that reluctance to seek access to health services is the principal health-related issue that men face.
Recently, we've conducted the Moustache for Men campaign. This is the Men's Health Initiative. During that campaign, we screened about 200 over men and then found that many of them actually have depression that has never been diagnosed. Many of them are severe depression. These are people who are on the verge of really collapse in terms of their mental health.
One reason for this unwillingness to seek help could be because of the healthcare experience itself, as researchers have noted that health programs often view men mainly as oppressors, self-centered, disinterested, or violent, instead of as complex subjects whose behaviors are influenced by gender and sexual norms. This idea of gender norms being at the heart of men's health is mentioned by a huge number of studies. So, just how much can male behavior, including the risk-taking that puts them in danger and their unwillingness to ask for help, be explained by gender norms? First, gender norms or gender scripts are what we expect men and women to do. For example, women should take care of the children, or men must be successful. These are not biological or genetic differences, but culturally accepted ways of thinking, feeling, and behaving. For example, the phrases, "Big boys don't cry," "Stop crying before I give you something to cry about," "Suck it up." These are phrases almost exclusively spoken to male children and are the start of something called toxic masculinity. Eldra Jackson, a former prison inmate and now co-executive director of Inside Circle, an organization reducing violence through empowerment, said he had a chronic case of toxic masculinity that led him to a life sentence for kidnapping, robbery, and attempted murder. This may be an extreme example, but it's not an isolated one. Toxic masculinity has been defined by researchers as a set of behaviors and beliefs that include suppressing emotions or masking distress, maintaining an appearance of hardness, and violence as an indicator of power. In other words, toxic masculinity means teaching boys that when they cry or express fear or pain, that makes them weak or feminine. But it's not just toxic masculinity that causes problems. Traditional masculinity ideology is the belief system that a real man should be, amongst other things, self-reliant, strong, successful, and able to provide for his family. While these are positive traits, if they are not balanced with more gentle traits, they can become restrictive. The American Psychological Association have said that men who are socialized to conform to traditional masculinity ideology are often negatively affected in terms of mental and physical health. And multiple research studies have confirmed that men who strongly identify with these traditional definitions of masculinity are less likely to consult medical professionals. Sadly, the outcome doesn't just affect physical health. Professor and speaker Robert Jensen has said that masculinity in patriarchy, that is, masculinity in a system of institutionalized male dominance, is relentlessly competitive, focused on conquest, which leads to inevitable confrontations, all with the quest of staying in control of oneself and controlling others. But despite all that, men never really feel man enough. Family therapist Terry Real agrees that our traditional gender roles don't make anybody happy. He says that in his work with couples, he's realized that in order to lead men and women into happiness and intimacy, we have to lead men and women out of patriarchy, because the old rules were not built for intimacy and happiness. So, where do we go from here? Are we really saying that if we smash the patriarchy, men will live longer and happier lives? There's no guarantee of that, but piles of evidence do show that restrictive gender norms held up by the system of patriarchy are damaging to both men and women.
Why should we dismantle patriarchy? The short answer is that it's toxic. Obviously to those who are disadvantaged by it, but also those who seem advantaged by it, because it limits our potential. Fundamentally, we're all humans, and when people are forced to fit a particular mold, whether it's boys or girls, men and women, many people are needlessly suffering, because of all of these systems of oppression that are really, really unnecessary if you think about it.
So we've uncovered the reasons why men are dying earlier than women, and the biggest contributor is probably the most difficult to change: traditional concepts of masculinity. As with all cultural shifts, the more we talk about it, in schools, with parents, to doctors and researchers, inch by inch the shift will come. But while we chip away at the roots, we should still work to improve the symptoms.
So currently we're trying to develop a men's health index, which is trying to measure the men's health status in each country, so that policymakers then can assess the men's health status in each country and compare with another country, so that they can gauge where they are. As through this, that policy perhaps can be shaped and changed, and men's health in this case can be improved.
The WHO has also given 3 recommendations that would improve men's health. Firstly, they say, stereotypes about masculinity should be challenged in schools. Secondly, men's health and well-being should be promoted in the workplace. And thirdly, health services and health promotion should be targeted towards marginalized men, all of whom have a higher burden of disease and early death than other men. It is also important to recognize that early parenting interventions can provide the necessary boundaries and safe space for boys to grow into happier, self-confident boys who are better able to face the demands of our changing society.